Uh, my question to Dr. Dam is that we are talking about integrative palliative care. So, would you throw some light about allopathy and AYUSH streams?
Yeah, these are other streams of medicine which are practiced in India. Uh, and I do feel that integrating all such streams are very important because very often we come across patients who, in the terminal stages, would prefer to undergo some allopathic treatment, some homeopathic treatment, or some other modality of treatment. And it's fine. I mean, these systems of treatment have been in existence since ages, even before modern medical practice actually came to India. I mean, we should be learning from our ancestors like Shushrut and who pioneered so many different modalities of therapy which are now borrowed by modern medical practice. And I personally have trained and I use simple therapies like massage therapy and a particular type of Siddha massage therapy called Varmam, which I use on my patients, and with excellent results. Especially for if the patient is very tense and if the patient is in pain, if the patient can't sleep, it helps to relax the patient so well. Here we are focused on improving the quality of life. So, if the quality of life can be improved by using such modalities, we would welcome it with open arms. And such modalities need to be integrated with the modern system of medicine so that the patients can get the maximal benefit out of the whole thing. These are and have been in existence in India since ages, and I see no reason why they should not be integrated into improving the quality of life of a terminally ill patient.
Thank you, Dr. Dam. Mr. Menon, we've been listening about AYUSH, AYUSH, AYUSH. Can you elaborate what AYUSH is?
Ayush is a very good terminology, but most of the people do not know what Ayush is. Most of my friends used to ask me the same question: what is meant by Ayush? I was also not aware of the detailed definitions that is contained in that Ayush, the acronym Ayush. A stands for Ayurveda. Ayurveda is our traditional medical system, and the U stands for Unani.
Why you forgot?
Y stands for Yoga and Naturopathy, and U stands for Unani. S stands for Siddha system of medicine, and H stands for homeopathy. These are very simple. These are all available, and we are making use of such modalities during our lifetime in our daily life. But we do not know what Ayush really is.
So, these are the traditional Indian medical systems which have been practiced in India since time immemorial. However, we are not aware about the terminology AYUSH because AYUSH ministry was formed later so as to integrate all these indigenous medical systems. As rightly said, A stands for Ayurveda, Y stands for Yoga and Naturopathy, U stands for Unani, S stands for Siddha. So many of us may not be knowing what Siddha is. It is the medical system similar to Ayurveda, but it belongs to Tamil Nadu. And H stands for homeopathy. So with this, we would like to sum up that integration again is very important. Dr. Dam is a allopathic practitioner. However, he encourages practicing and integration of all the medical systems. So that is what we expect from all the doctors of the modern medicines. They are in no way contemporaries, but they should be ready to integrate their own expertise. Thank you. Have a great day.